Hi, Tom Lewis here. I want to tell you a little bit about my story about why I'm so excited about what we're doing and how it can relate to a solution for SUD. My dad died of Alzheimer's disease about 17 years ago, and 16 years ago I met this very remarkable clinician at Harvard, Dr. Clement Tremp, and along with him, Dr. Kilman McCulley. These two seasoned clinicians showed me some truths that I just could never forget or never ignore.
I was born and grew up in Moscow, went to medical school there, did my training in Germany in psychiatry and neurology. I practice mostly interventional pain management, addiction, and functional medicine. I am board certified in 8 areas medicine.
But as I've gone along in my journey, I found really that there are significant gaps in the delivery of healthcare, particularly in the prediction, diagnosis, and reversal of chronic diseases. And of course, my specialty and passion is Alzheimer's and brain-related diseases. For the last 15 years, I've ran a business based on what I consider this new health program, based on really refining, measuring, and reversing and preventing chronic diseases, particularly brain diseases. But as a scientist, I think my scientific acumen is superior to my entrepreneurial acumen, thus applying for this award. The CDC states that 90% of costs are due to chronic disease. Everything in life resides on a continuum. And in our 4 dimensions of health, determinants of health, physiology, pathology, and disease states, each of those can be defined based on a continuum. But the most objective and easiest to measure is physiological health.
I think to me, it's as a clinical doctor, it's absolutely obvious that, all information is important, of course. However, without knowing how and at what point of the physiological health or disease spectrum that particular human being is really deceiving, because it won't give us any practical information on how to treat that particular situation. We won't be able to explain the difference between the human response.
Now, reference intervals have expanded over time. So in other words, people who used to be considered sick are now considered well. So we have a lot of people who are apparently well, but actually at high risk of sudden or severe chronic disease. We've gone into the medical literature and looked at important markers that look at disease from a chronic perspective, cytokines and their surrogates, things of that nature, white blood cell counts, to see and look at objective endpoints, particularly increase in statistically validated early mortality. What we've seen is what nature is all about. We see a log linear relationship between the marker and an increase in early mortality, and built an algorithm around each marker. And then since the endpoint is the same for each one, we arithmetically put them together to create a single score out of multiple markers. And we happen to be using 20 markers. And we call that entire algorithm, or that score, your chronic disease temperature. And I think it's profound because it gives a really good way for a doctor, for a practitioner, to measure progress or the lack thereof in a patient. But it also gives the patient a very simple barometer to see how they're doing. But I see a huge opportunity to make changes in healthcare with the platform we've developed. And that will clearly spill over in terms of properly diagnosing and finding causation in SUD and helping these patients. Perseverance and grit. I recognize with the help of Dr. Tremp and McCulley that there's shortcomings in the existing healthcare system. Somebody had to do something about it, so there's your perseverance. But in terms of grit, I will stay with this till the end. And my pastor up in Boston, Bishop Borders, said, what I'm doing may well take 2 lifetimes. Regarding being rejected, I had to chortle a little bit when I read that question, because we've been rejected every which way but Sunday. One of our absolute best pilot programs with 100 people in an Indiana company, I'd have to tell you and show you through case studies that we performed nothing short of miracles compared to what was being performed in the standard of care with some of the participants in our program. Yet we didn't get extended, mainly because the on-site clinic manager, a very large concern, re-ruffled the feathers. Our approach when we get rejected is to roll up our sleeves, go back, get more data, find people more open-minded to our processes, and just keep traveling down that road. The old Chinese proverb is fall down 7 times, stand up 8. Stay resolved to the mission. I'm passionate about this because what happened with my dad and the standard of care. So there has to be a solution, and I'll work at it for the rest of my productive life. Thank you very much for your time.